dealt with in an emergency department, and the emergency department basically traumatises people. And what we were looking for in working in our emergency department collaboratives was a way to actually give people an alternative that was safe and therapeutic and felt okay for them to be in if they didn't need to be in the emergency department. So we were very lucky. This is a pilot from the UK. We were really lucky enough to attract some funding from Better Care Victoria. They gave us 12 months funding so that we could set up the cafe for 6 months. 18 months down the track, we're still here. We're desperately seeking sponsorship, but we're still here. And so the idea was that if someone presented to the emergency department, they could be given a little piece of paper that would say there's an alternative. If you don't need to be here, you can come across to the cafe next time. The staff could bring people across to wait here so they didn't have to wait in the very sterile waiting room. And it started off very slow because it's really interesting. The hardest thing to do is to get the information out to the people who actually need the information. And the usual resources that health services use didn't work. So talking to case managers, talking through the systems that we know didn't actually work. So we experienced peer work in our emergency department, and that was the best way that we could get the information to the people that needed it live while they're over there in the emergency department. And slowly over time, the word has spread across Melbourne. So we get lots of people who are referred by the people who've already been here, or by emergency departments who know that we exist, sometimes by GPs. Wherever we can find the information, we encourage people to let them know about the cafe, and we have posters across the city to let people know that we're here. So we've been here 12 months now. We've had over 1,200 visitors. We call them customers. So this is set up as a cafe. One of the things that we know is that often when we're trying to give people an alternative, it's often done on a shoestring, and it can look quite half done, if you like. And so being able to use the gallery space here meant that we were offering something that was truly welcoming and something that actually is respectful and dignified. And people have responded very well to that, and they love the space. We do get some people who are homeless, particularly females, who don't feel safe where they're sleeping. So they might pop in behind you, or some of you will see it, most of you won't. We have a couple, we were only able to put one out today, but we have a couple of beanbag couches so that people can actually have a proper sleep here because this is the place that they feel safe. The things that we know are that people need to charge their phones because they don't get the ability to do that, and they need to have good quality Wi-Fi so that they can check out where they can get free meals, where they can get emergency accommodation, find out how they can get to a GP, those sorts of things. We can help them to do that. The cafe is staffed by a clinician, so meet Ben, who's one of our clinicians, and by our lived experience peer workers. So say hello to Jono, he's one of our lived experience peer workers. And we were hoping to have one of our customers come in today, probably not talk to everyone together, but at least be able to let people know what it's like to experience the cafe. We have done an evaluation. There were 3 findings from the evaluation. The first one was that we certainly did save the resources of the emergency department, so we did decrease those presentations that didn't need to be in the ED. The second finding was that people had a better experience of the overall health service that we offer as a result of the cafe. And the third and most important finding, and the one that we did not expect, was the sense of social connectedness that people felt. So to translate that, in health terms, we don't deal in loneliness because we deal with clinical issues. But the world at the moment is experiencing an epidemic of loneliness. And one of the things that people find by coming here is that they feel connected, and that helps them not feel so lonely and isolated, and it means that they feel less distressed and more able to be able to get on with the functions of their life. So those 3 findings were enough for us to be able to attract continued funding from within St Vincent's Health Australia for the next 12 months, and a guarantee from the organisation that it will be permanently funded after that. So we're really pleased about that. We've had lots of interstate visitors, and there are now 6 cafes being set up in Queensland. one being set up in Western Australia and a hybrid model being set up in New South Wales. So the word is spreading, the information is there. It's not an expensive model, so it's one that most places can achieve with a little bit of funding or sponsorship. So getting a little bit creative, and the model is also a bit plastic so that you can stretch it and make it whatever suits your particular community. So here we deal with the inner city. We know that we're going to have quite a lot of homeless people, and that people who are living in tower blocks and often feel that they can't get out and about as freely as they would like to, and it's more expensive in the city. So going and getting a coffee. So here what we offer people is a coffee or a tea, or a soup in the winter, and a snack, and the ability to just be how they would like to be. So some people come, they might read the newspaper. We supply a newspaper for people to read. They might read the newspaper and then go, or they might go and have a nap and charge their phone and go, and others like to have that social connectedness. Whichever way people want to be is okay with us.
I have a question. This is
Go
so
for it.
fabulous. I've been doing research on alternatives to emergency departments.
Yeah.
And one of the issues is the ways in which people who genuinely need help are treated in emergency departments if they don't fit in the triage model that's part of the emergency department. Regardless, all those people need help, but they're stigmatised as time wasters. And I'm just wondering if you've done any work in tandem with this to kind of try and bring emergency department professionals to kind of change some of their attitudes about the clientele that they use this.
I think the work that we've done is more accidental than deliberate. I would say to you as a health professional, I've done this job for 41 years. I've worked in mental health. So I've seen a lot. And I also know that people do get burnt out and they get busy and, they have a particular task to do. Nobody comes to work to do harm. But when they do come to work and people present continually and there isn't anything they can do to help, it plugs into our helplessness and then a dynamic is set up. So what we try to do is we try to work with the clinicians around, send them across to the cafe, and we are at a point now where our triage nurses will actually bring people over themselves. So accidentally what we've done, by placing the lived experience peer worker in the ED, we've changed the relationship. And so the way that that person deals with somebody who's lonely and isolated and sitting out in a waiting room for 4.5 hours, I don't know about you, but the last time I sat for 4.5 hours, I got a bit annoyed. And it doesn't go down well. So, but having someone to sit with you and distract you and, just talk through things means that you're less likely to attract attention to yourself. And that's changed the way that people then relate when the person comes through. And the fact that they have somebody who can actually say, I talked to this man and he told me that he is actually feeling really sad because, his dog died or he's lost his home or something that we have no idea about that they would normally not tell us. Because the other thing that we do know, sadly, is that a lot of people don't trust health clinicians. And that's really sad. And that's probably, something that's occurred over time. But I think we have made a big dent. And I think the difference, because Jono also works in the ED and works in the cafe, so you might be able to say more clearly if you've noticed any difference in the way that clinicians respond in the emergency department.
Yeah, I think people definitely have their guard down a lot. Firstly, when you're not clinical, but also if you have lived experience and you can kind of come at it with your own slant on things, just having your own experience and What else to say actually?
Yeah, so I think it's not something that we deliberately do, but it's certainly something that's been a side effect of what we have done. And we have noticed that the relationship is very different. When we first set up, there was a lot of concern about how we were going to manage a space that is sitting right in the middle of a clinical space, but is not a clinical space. We don't do anything to people. People come here and be however they want to be. And there was some concern about, well, what are you going to do if there's a problem or a drama? Over time, people have relaxed about that. So, I think that's another aspect of the wins that we have had, is that people are actually seeing things in a different way and beginning to think about why people come to our emergency department. because they're not actually coming in and saying, I'll come here because it's 2 o'clock in the morning and I'm really lonely and I've got no one, I haven't spoken to anyone for 2 days and I feel so desperate I'd rather jump off my balcony than stay in my flat, so I've come here to stay safe. They don't say that. They come and they say, I've got a headache, and the headache won't go away, and you've got, 3 heart attacks and, 6 other dramas, and you haven't got the time to actually say, well, tell us what your headache's about.
Yeah, I think that's another thing that the workers can provide. It's just,
Yes.
it's just we've got a lot more capacity to spend extended periods of time, sometimes up to hours, 2-3 hours with someone, or you might be coming and going. So while, they're seeing their doctor or getting scans or whatever, you go away, do whatever you need to do, come back.
Yeah.
And over that period of time, people start to open up about things once they build the trust and they start to tell you things that they might not tell other stuff. Yeah, that's when the real stuff comes out. And
Correct.
you're able to work that in with the
And you can be that link, can't you? And that advocate that can go through to the doctor and say, look, this person's been in the waiting room for 3 hours. They're telling you they're going to leave, but I don't think they're safe. And because the lived experience workers have that direct relationship with the consultants, then the consultants then trust that they're not going to come to them with something trivial. So they will move them forward if they need to.
Do you know of any other hospitals that are looking at the model?
Yeah, there's a few. I've been to see Royal Melbourne. They're looking at, 6 hospitals were given some money last year to set up what are currently called drug and alcohol and mental health hubs. And so Royal Melbourne is one of those, and they're thinking about how they can make cafe and the EDP worker work within that. Eastern Health have been to visit. They're thinking about both Maroondah and Box Hill and how that might look with them. So there's plenty of interest. Hello.
Hello. Autism, if they're autistic with mental health issues, because this is a big problem in our community, is that the lack of understanding and support.
Yep.
If they were to come to a place like this, would they get understanding and support based on both conditions?
We don't assess, so we don't ask any questions. So if you come to the cafe, you don't have to meet criteria to come. Anyone can come and
sensory needs and things like that as well.
We call ourselves a therapeutic safe space, but we don't actually offer any clinical intervention. And we have to be really careful about that because we're not a clinical space. We can't offer clinical intervention, and sensory stuff would be considered. But having said that, if you have a little look around, there are things like puzzles and particular pillows, and we did deliberately do that because we know that lots of people self-soothe by, I don't know if anyone's got a cat at home, but that lovely furry cat that you can stroke. So we've got a couple of cushions that look like a cat. No, they don't. They're just furry. But so there are different textures and things around. If somebody specifically came and said, I'd like to come back, but I have sensory needs, they could bring their sensory supports with them by all means. So if somebody wanted, music is another really common. I mean, I do it every morning when I'm dragging my feet to work. I use my music to make me get to work. Don't tell my boss though. And so, music's really important to people, but rather than have music blaring out that might annoy people, people can use their earphones. We don't stop people from using whatever they need. We've actually had a support dog in here with somebody. So, we try and be inclusive and we don't exclude people. The only thing that we ask of people is we have a set of expectations that we have designed with the customers before we set up with the potential customers, and we ask people to meet those expectations. And so the only thing that people were very clear about that they would struggle with before we opened up was that they felt their safety might be compromised if somebody was here drug or alcohol affected. So if we believe that somebody's affected, we ask them to leave. We've only ever had one issue with that, and we managed to get that dealt with and sorted out, and the person then got the care they needed in the emergency department.
So would you be open to having some extra training or information on if someone was experiencing mental health difficulties?
I guess, it's constantly a struggle for us, is that we do have some lived experience people who have. So the guys that we met today are not our only, they're part of our team. And we're certainly happy to learn things. but we wouldn't be learning it. It would be an interest thing rather than we have to be really, it's a very fine line when you're trying to hold a non-clinical space to actually then introduce things that could be construed as clinical and that we could be held responsible for.
No, you're making some really good points. It's just the autistic community have lost, like many others, have lost faith in the medical system.
Yeah.
And presenting because we're dealing with two different conditions.
Yeah.
And trying to work together.
Yeah. Well, yeah, and although we don't highlight mental health in any way, we do actually have clinicians that have got a range of expertise, and these days most clinicians have to do that extra. They do in mental health. They do that extra training in the autism spectrum disorders. So hopefully they'd be able to pick those things up, and hopefully the people would help us to learn that. But we're more than happy to have information that we might need.
Fran, if word spread about the Safe Haven Cafe, would you, I'm not sure what hours you're open and available, would that be a problem? Like, obviously, if more people heard about it.
Yeah, so we chose our hours deliberately because we're looking at the people who don't have access to services or somewhere to go out of hours. So what we're looking at is providing, we currently are open from 4 till 8 on a Friday night. That will soon change, probably till around 2 till 8 on a Friday, Saturday and Sunday. But at the moment it's 4 till 8 Friday and 2 till 8 on Saturday and Sunday. And part of that is about encouraging. We are in the CBD. We do want to encourage people to get home safely. We can't escort them. We can't send them home in taxis. So we want to make sure that people leave at a reasonable time so that they can get home. We do have some busy times. There are times when we've had, up to 16 people in one afternoon. They generally are stretched out. People tend to come, stay for a while and go. And so we deal with the busy times by just calling in for some extra help. You can imagine 16 people in here, it makes it pretty lively, but that's okay as well. So we're not worried that we would be overwhelmed. We certainly haven't been overwhelmed in the last 12 months. We've been stretched, but not overwhelmed.
Excellent. Well, thank you so much.
You're welcome.
Fran. That's fantastic. We've got a little bit more time here if people want to just, have a bit of a chat amongst yourselves.